I love to answer real questions from real people, which is what I'll be doing in this video today. If you have a question that you'd like to ask me, just simply email me at support@rickolderman.com and I'll do my best to get to it. Also, just to let you know, I have a new book coming out in the fall of 2024 called Pain Patterns, Why You Have Pain and How to Stop It. If you would like to receive a notification of when my book is out, just mention that in that email too. This question is from Ruth. I am in chronic pain from replaced knees, lower back pain, neuropathy in feet, etc. My doctor won't prescribe meds because I'm older and neither of us want me to become addicted. What do you suggest? So my general answer is that when you have both knees replaced or any other joints or even just one joint replaced, while rehab addresses a lot of the length and strength of that joint, rehab also often doesn't address the biomechanics that led to the breakdown of those joints in the first place. Also, typically rehab does not address tension in the system. By tension, I mean excessive muscle tone or tension that also restricts joint movement. So while you may have regained full range of motion and maybe even full strength, the fact that you haven't fixed the biomechanics that occurred that led to the breakdown of those joints in the first place and the tension that resulted from that breakdown and or the surgery, often what that does, that tension causes joints to restrict movements and it prevents us from moving more fluidly and supplely. And so this is when other pain starts to happen, is because that's when we start to become very stiff in our gait patterns, how we're sitting and standing. So the more stiff that your legs become, that typically then manifests in the pelvis as stiffness in the hip joints, the SI joint, and then also where the pelvis meets the spine at the lumbopelvic region. So knowing that you're 76 years old, I'm going to guess that you have quite a bit of tension in your system. This is something that I was not trained to identify in physical therapy school or any of the continuing education courses I took for many years until I stumbled on somatics. And somatics is a method of reducing tension in our system. I'm going to take a break here to ask you to please subscribe, like, and hit the notification bell so that you'll be notified when future videos come out. Thank you. I have recorded 8 somatics audio lessons to help people reduce tension in their system. You can find those on my website at rickolderman.com in my Fixing You Method programs. There are 8 of them. They're each about a half hour long, and they are very relaxing and reintroduce supple movement. These somatics lessons that I've recorded help a lot of people reduce tension and therefore pain associated with tension. The other thing that often occurs for people needing knee replacements or hip replacements or shoulder replacements or whatever kind of replacement you're looking at, is that most surgeons will tell you to hold on as long as you possibly can before replacing that joint. That's in general good advice. However, what I have found as a clinician is that most people wait too long. And so what they've done is they've developed secondary and tertiary problems involving shorter muscles. Their gait pattern is affected, and they develop a gait pattern that is asymmetrical, that then causes other problems elsewhere in the lower body system and the back. Another problem is that strength imbalances begin to occur, where one leg becomes more loaded than the other subconsciously, because the brain is very good at creating subconscious compensations to get around problems. And if one of your knees is breaking down and hurting, your brain will subconsciously start having you transfer that weight to the other leg. And so oh yeah, I can get by with this knee pain, no problem. But then the other knee pain starts to break down, and then you're left with two knees that need replacement. And in the meantime, while that's been occurring, your pelvis becomes uneven because of the transfer of weight and usage to one leg in favor of the other. And when the pelvis becomes uneven, then the spine becomes uneven, and you get breakdown in the spine of one side versus the other too. So you can see how, you know, subtle changes in how our body is used can have enormous ripple effects up and down our spine. And so when I hear a question like yours, I've had replaced knees and now I have chronic, back pain and neuropathy. By the way, neuropathy, I'm not sure what the situation is with your neuropathy. If by that you mean radiculopathy, I've made a video here about radiculopathy. And if your pelvis is uneven and your back pain is more on one side than the other, then likely you have a side bending problem. I've made a video here that talks about that. And maybe you've been told that you have a leg length discrepancy. Well, I've made a video here about that too, so that you can understand that you probably really don't have a true leg length discrepancy. What you have is an asymmetrical usage of how you're using your body that is causing asymmetry in how your body is going about its day, which is then causing chronic pain. So at the risk of sounding like I'm just trying to sell you something, I would really strongly recommend that you try those Hannah Somatics lessons. I've made them very affordable. And see if reducing tension in your system makes a meaningful change in your pain. That's the first step I would do. Especially as we get older, we get stiffer anyway. I mean, I'm feeling much stiffer than I was 10 years ago. And so stiffness is just a natural development of growing older anyway. And so the older I get, the more I rely on techniques like Hannah Somatics to relax and lengthen my body, my muscles naturally. So that would be my first step. And then the second step, if that helps, that may be all that you need, is one of those lessons. They each address a different pattern in the body. And for instance, lesson 5 addresses the hip and knee. That may take away a lot of your hip and knee and back pain, in and of itself. So you can experiment with those lessons and see if they help you. So if you want to dive into more of fixing the asymmetries of your mechanics that are causing your pain, then I've created digital home programs that will guide you through that. Other than that, if general exercise like Pilates is a great way to lengthen and strengthen joints and tissues gently. Especially, and I'm not talking about the floor Pilates, because someone who's had 2 knee replacements and 76 years old and has a lot of stiffness and pain likely needs Pilates reformers work where, you're on a machine, it's that medieval looking machine with a lot of ropes and springs and so forth. But there are great machines, and most Pilates instructors will be very helpful in helping you unwind your body and lengthen problem areas and strengthen problem areas. So that would be another thing I would look for. Now, if that doesn't appeal to you, I think maybe working in a pool, especially if there's a warm pool around you, then that would also be a nice way to get started, and doing like a gentle pool aerobics program. Usually pool aerobics is very low impact, and it gets people moving, it gets them feeling better, and of course the water is unloading joints so that you don't have all of those ground reaction forces causing all of the compression through all of this already irritated tissue. So that's another thing I might recommend. So hopefully that helps you, Ruth. Somatics lessons and or Pilates sessions and or light aerobic lessons in the pool might be just what you need to start unwinding your body and start restoring more natural movement, which will decrease your pain. I hope that helps. If you would like to be notified of my new pain patterns book coming out, please send that email to support@rickolderman.com. Or if you have a question for yourself, please feel free to mention that in the email too.